வணக்கம் நண்பர்களே. இன்னைக்கு நாம பார்க்க போறது அறிவாம் தமிழ் சங்கத்தினுடைய உடல் ஆரோக்கியத்திற்கான தொடர் வரிசையின் 2வது பாகம். உங்க எல்லாரும் தெரிஞ்சிருக்கும், நம்ம அடிக்கடி கேள்விப்படக்கூடிய ஒரு வருத்தப்படக்கூடிய ஒரு விஷயம் கார்டியாக் அரெஸ்ட் மற்றும் ஹார்ட் அட்டாக். நம்ம வாட்ஸ்அப் குரூப்லையும் நம்மளுடைய உற்றார் உறவினர் நண்பர்கள் மத்தியிலையும் சம்டைம் கேள்விப்படக்கூடிய ஒரு வருத்தப்படக்கூடிய ஒரு விஷயம் இது கார்டியாக் அரெஸ்ட் அண்ட் ஹார்ட் அட்டாக்ங்கிறது. இப்போ என்ன பண்ண போறோம்னாக்க, தமிழ் சங்கத்திலேருந்து நம்ம எடுக்கக்கூடிய ஒரு தொடர் நிகழ்ச்சியில இதை நம்ம ஒவ்வொரு வாரமும் ஒவ்வொரு மாதமும் ஆக்சுவலா ஒரு ஆரோக்கியத்திற்கு சம்பந்தப்பட்ட ஒரு தொடர் நிகழ்வை நடத்தலாம்னு பண்ணிட்டு இருக்கோம். நம்ம அதன் தொடர்பாக இன்றைக்கு பார்க்க போறது முக்கியமாக ஹார்ட் பத்தி. ஸோ இன்னைக்கு நம்மளோட வந்து அவருடைய அனுபவங்களை பகிர்ந்துக்கிட்டு அவருடைய அறிவுரைகளை கொடுக்கறதுக்கு வந்திருக்க டாக்டர் விமல்குமார் வீரப்பன் அவர்கள். வணக்கம் விமல்குமார்.
வணக்கங்க.
விமல்குமார் வீரப்பன் அவர்கள் வந்து சென்னையில கீழ்ப்பாக்கில் எம்டி முடிச்சுட்டு அதுக்கப்புறமாக இங்க கிரைடன் யூனிவர்சிட்டியில இன்டர்னல் மெடிசன் ரெசிடென்சி முடிச்சுட்டு அதுக்கப்புறம் லூயிஸ்வில் அங்க வந்து கார்டியாலஜி அண்ட் ஸ்ட்ரக்சரல் டிசீசஸ்ல எக்ஸ்பர்டீஸ் பண்ணிட்டு இப்போ பேனர் பாஸ்வெல் மெடிக்கல் சென்டர், பேனர் டெல்வெப் மெடிக்கல் சென்டர் சர்ப்ரைஸ் அங்க ஸ்ட்ரக்சரல் அண்ட் இன்டர்வென்ஷனல் கார்டியாலஜிஸ்ட் ஒர்க் பண்ணிருக்காரு. அவருடைய ஒரு சிறந்த ஒரு பண்பு என்னன்னாக்க, நான் அவரை முதல்ல பார்த்தப்போ ரொம்ப வியந்து போயிட்டேன். ஏன்னா ஒரு சாதாரண ஒரு மனிதராக அவ்வளவு படிப்பு படிச்சிருந்தும் இவ்வளவு விஷயங்கள் தெரிந்திருந்தும் அணுகுமுறை வந்து ரொம்ப ரொம்ப அதிசயமா இருந்தது. நம்மலாம் பார்த்துருக்கோம், நிறைய பேர் வந்து நிறைய படிச்சிருப்பாங்க, நிறைய சர்ஜரி பண்ணியிருப்பாங்க, ஒரு அப்ரோச் பண்றதே கஷ்டமா இருக்கும். ஆனா டாக்டர் விமல்குமார் வந்து வாஸ் வெரி ஈஸி டு மீட் அண்ட் டாக் அண்ட் வெரி ஃப்ரெண்ட்லி. ஸோ வெரி கிளாட், ரொம்ப சந்தோஷமா இருக்க வர நம்மளோட இங்க பகிர்ந்து வந்துருக்கிறதுக்கு. ஸோ ரொம்ப நன்றி விமல்குமார். இப்போ நம்ம ஆரம்பிக்கலாம். முதலாக விமல்குமார் அவர்கள் வந்து அவருடைய ஒரு ப்ரெசன்டேஷன் கொடுப்பார் நமக்கு. அதை தொடர்ந்து ஹரி அவர்களும் நானும் எங்களுக்கு வந்திருக்கக்கூடிய கேள்விகள் வந்திருக்கு நண்பர்கள்ட்ட இருந்தும் நம்மளுடைய வாட்ஸ்அப் குரூப்ல இருந்து வந்திருக்க கேள்விகள்லாம் பகிர்ந்துப்போம். அதுக்கு அவர் விளக்க உரைகளும் அறிவுரையும் தருவார் நமக்கு. அதை தொடர்ந்து உங்களுக்கு ஏதாவது கொஸ்டின் தான் கேளுங்க. we'll be watching on the online in the Zoom meeting. So அதன் பிறகு we will wrap it up nicely. Thank you Vimalkumar for joining today. இதை நிகழ்த்துறதுக்கு நானும் தமிழ் சங்கத்திலிருந்து என்னுடைய நண்பர் திரு ஹரி வெங்கட் வந்திருக்கும். ஹரி, உங்களுக்கும் ஒரு வணக்கம்.
வணக்கம். வணக்கம் விமல்குமார்.
Thank you ஹரி அண்ட் சரவணன். பிரசன்டேஷன் போலாங்க.
எஸ் ப்ளீஸ்.
எல்லாம் கேக்குதுங்களா? கரெக்டா கேக்குதா எல்லாமே?
கேக்குது.
ஓகே. So ஒரு சின்ன presentation just to like give a general idea about heart health and the risk factors. And so just a disclaimer, use this only for information purposes. And if you need to start any medications or anything, you have to talk to your doctor before starting it. Don't take this as a medication advice, because medication needs to be decided based on your health as a whole. It's not like we are treating a number or we are treating one specific condition. So I'm going to give a general idea about your heart health. So what is heart disease? General, so when the heart or the blood vessels supplying blood to the heart muscle doesn't work properly, that's when we get into heart disease. So most of the things, like we talk about cardiac arrest and heart attack. So those are two different things. Cardiac arrest, abina, it means that the heart stops pumping. That's cardiac arrest. Heart attack, abina, it means there is a blockage in the artery which supplies blood to the heart muscle. Now, heart attack can lead to cardiac arrest, but those are two different things. So we're gonna talk about like the general risk factors of heart disease and what can we do to improve the heart health. So heart disease is the number one cause of death in US and also all over the world. And maintaining a healthy heart at any age is important. And so according to WHO, 4 out of these 5 deaths are preventable, meaning if you take proper precautions, control all the risk factors, these deaths are avoidable. So this is a American Heart Association recommendations, Life Simple 7. What are the 7 things you can do to keep your heart healthy? And as number 1 is always eat a heart healthy diet. Number 2 is try to be physically active every day. Number 3, avoid smoking and using any tobacco products. Number 4, keeping a healthy weight. Number 5, keeping your blood pressure healthy. Number 6, keeping your total cholesterol healthy. And number 7 is keeping your blood sugar healthy. So if you can do all these things, then you are controlling all the risk factors for developing heart disease. So heart healthy diet. So, and eating a healthy food is one of the most important ways to keep your heart and body working at best. And so the earlier you start in maintaining a healthy diet, the longer you can keep your heart and body healthy. So I'm going to touch on like what are the things that are healthy and what are the things which are unhealthy for your heart. So in general concept is that try to include more whole grains, fruits, vegetables, low-fat dairy products, poultry, fish, and nuts, and limit sodium, sugary foods, and beverages, and red meat. Red meat now, like it's beef and pork. And reading nutrition label is very important. Please keep a habit of looking at your nutrition label, which is a very good thing. That gives you a lot of information about what's good and what's not good. Okay, so first look at the serving size. Make sure the information is for each serving. So look at the serving size. See what, like, so you get a better idea about like how much is and what. So then look at the calories and look at the ingredients. Saturated fat, trans fat, and sodium. You have to limit these things. These are not heart healthy. Protein, dietary fiber, these are good. So you can make your own decisions based on like the nutrition facts in each of the food you take. So what's bad fat and what's good fat? You know, bad fat or saturated fat and trans fat. So what are the food that has saturated fat? So fatty beef, bacon, sausage, lamb, pork, butter, cheese, and any other dairy products made from whole milk. These have bad fat, and bad fat increases LDL level. So LDL அப்படினா என்னன்னா, so your cholesterol profile, அப்படி பார்க்கும்போது pay attention to what your HDL level, which is the good cholesterol, and what is your LDL level, which is the bad cholesterol. Total cholesterol is important, but look at the LDL and HDL. That's more important, because sometimes even if your good cholesterol is high, that can make your total cholesterol appear high. So pay attention to what's your LDL level and HDL level. So keeping the LDL level low is very helpful for the heart health, because LDL is what is a culprit for development of blockage in the arteries, essentially. So saturated fat, we just talked about it, and then trans fat are both naturally occurring and artificial. However, most trans fats, also known as trans fatty acids, are found in processed food, and sometimes they're labeled as partially hydrogenated oils. So which food have trans fat? Fried foods, French fries, fried chicken, baked goods like donuts, cakes, pies, cookies, as well as frozen pizza, stick margarine, are common culprits for trans fats. So trans fat and saturated fat both increase your LDL level. So the American Heart Association recommends that adults limit their consumption of saturated fat to 5 to 6% of their total calories. What are the healthy fats? You know, the monounsaturated fat and polyunsaturated fat are healthy fat, and they can improve your cholesterol levels and lower your risk of heart disease. So omega-3 fatty acid is good. Fatty fish such as salmon, trout, herring, flaxseed, kale, spinach, walnuts, these are all good. And the other sources of healthy fat include olive oil, avocado, nuts, and nut butters. So know what fat is good, what fat is bad. That can help you make some good choices. And in general, just some pointers on like what can you do to eat healthy. Fruits and vegetables are always good. And choose whole grain foods like whole wheat bread, oatmeal bread, more brown rice. These are good source of dietary fiber. And fish is good, especially oily fish, salmon, trout, and herring. Try to eat it twice a week if you can. And as we discussed, limit saturated and trans fat intake to about 5% of your total intake, and limit the amount of red meat, and choose lean meat and skinless poultry. And when you choose dairy products, try to choose low-fat dairy products like skim milk or low-fat yogurt. and limit your intake of beverages and foods with added sugars. As you know, like 12-ounce soda can has 8 teaspoons of sugar. If you think about it, you know how much sugar you're taking in with every sugary beverage. And sodium increases your blood pressure. So look at the sodium level in the food you're taking. And nuts are really good source of nutrition. And try to have some nuts, and mainly take unsalted nuts if you can. And drink water instead of sugary drinks, and try adding slices of fruit to beverages instead of sweetening with sugar. And fiber is also good. Diet high in fiber can lower the bad cholesterol and provide nutrients that protect against heart disease. And it can also help you lose weight, and it gives you a sense of fullness when you have more fiber in your diet, and helps you eat less and maybe lose weight too. And fibers are found in whole grains, wheat cereals, vegetables, carrots, celery, tomatoes, and also soluble fibers are in barley, oatmeal, bean, nuts, fruits, essentially. Physical activity is very important. Regular physical activity helps keep your heart, muscles, bones, and joints healthy and strong. And also it'll make you feel better in general. It's helpful for mental health as well. Try to exercise for at least 30 minutes a day and at least 5 days a week. And a 30-minute walk a day, most days of the week, will keep your heart in a good shape. If it is hard to do 30-minute walk, try to do 2 15-minute brisk walks. Highlight the fact that you have to try to do a brisk walk. A brisk walk, walk enough to slightly increase your heart rate. That is more important than walking at a slower pace. And smoke is very, very bad. Traditional cigarettes, electronic cigarettes, e-cigarettes, vapes, smokeless tobacco, everything is some of the worst things you can do to your body. Nicotine gives the pleasant feeling. That's what makes people try to go back to smoking. And vapes, electronic cigarettes all have nicotine. And any tobacco product nearly damages every organs in the body, and leading cause of heart disease and cancer, the top 2 causes of death. So these are some of the harmful chemicals that can be found in tobacco or smokeless tobacco. And you can look at it. Some of these chemicals are used in, what are the other uses for these chemicals that you get from smoking? So acetone, cyanide, hydrogen cyanide, methanol, cadmium, hydrazine, toluene. Even there are some radioactive chemicals in it too. Secondhand smoke is equally dangerous. Again, emphasizing the same fact. Keeping a healthy weight. So gaining too much weight at any point in your life can be unhealthy, essentially. So being overweight or obese can be dangerous. I mean, I don't want to scare you, but I'm just saying it's not a healthy way to keep your heart healthy. Obesity increases the risk of diabetes, heart disease, high blood pressure, asthma, and other issues. So BMI is one good way to see what your ideal weight should be. And this is a Mayo Clinic study which showed men with waist measurement more than 40 inches or women with waist more than 35 inches were considered obese. And also, most important thing is body conserves excess calories in the form of fat. So if you're taking in more calories than what you're spending, body tries to conserve and store these energy in case if your body needs more energy in the future. So that's how all the carbs and extra calories are converted to fat and stored in the adipose tissue. That's like the subcutaneous fat. And so the general concept is, if you take in less calories than what you're spending, then your body will start burning the fat to give you those extra calories. And blood pressure. And so measuring blood pressure is very easy. And it just general measurement of how healthy your blood vessels are. If your blood vessels are flexible and healthy, your blood pressure is going to be good. If your blood pressure becomes less flexible for whatever reason, for the development of stiffening over time, can also lead to high blood pressure. Genetics plays a factor in high blood pressure too. So it's an important risk factor for heart disease, and most people don't have any symptoms initially when the blood pressure is high, and high blood pressure over long periods of time can lead to a lot of issues. And there are other things which control the blood pressure too. Keeping your weight healthy is number one thing that you can do to keep your blood pressure in the normal range. Sodium intake is a very important factor in keeping your blood pressure in the normal range. Physical activity helps as well. And keeping your total cholesterol in a normal range is very important. And like I mentioned, pay special attention to LDL and HDL levels, and trying to keep your LDL level under control is very helpful in the long run to keep your heart healthy. So what happens is the LDL cholesterol, when it's very high, and if you have other risk factors like diabetes, family history, to develop heart disease, the LDL cholesterol starts getting into the in the blood vessels, causing the blood vessels to start narrowing over time. I'll show you how here. So this, not an artist, but I'll try to show you here. So this is a blood vessel. It has 3 layers, and so intima, media, and adventitia. There are 3 layers. So when the LDL level is high, and if others in the presence of other risk factors like smoking, diabetes, and family history and whatnot, the LDL starts depositing between the intima and media. So it just starts going in here, and as the LDL level LDL keeps depositing, there's a plaque deposition between the intima and media, between the inner 2 layers of the heart. So as the LDL keeps depositing over time, the intima keeps narrowing over time. Like the space between intima and media expands, and it narrows the blood vessel. So the blood is going like this, and over time, as the LDL, oxidized LDL essentially, gets deposited into the inner layer of the blood vessel, you can start having this narrowing. Usually you won't have any symptoms until this narrowing is more than 50%. In general, more than 70%, but sometimes more than 50%. And that's when there's a restriction of blood flow to the heart muscle. So, and that's what causes chest pain and all sorts of symptoms. Now, heart attack happens when the thin layer of blood vessel over this plaque ruptures. Like if there's a rupture or break in the layer, then it forms a blood clot over it, causing 100% occlusion. That is what's called heart attack. Like there's a blood clot forming here, and that's what causes heart attack. And so this is how, in general, how the blockage formation and heart attack happens. And I can talk about this more if you have any questions, but this is like a general concept of what happens with the blockage formation and what happens when you have a heart attack. And getting a regular health screening with your primary care doctor is very important. Check your cholesterol levels at least once a year, check your blood pressure once a year, or you can just get a blood pressure cuff. It's very easy to check blood pressure at home. Check it once in a while. Make sure it's all in the healthy range. Keeping your blood sugar healthy is very important. Diabetes is one of the top risk factors for developing heart disease. So when you consume food or beverages that contain carbohydrates, that's converted to calories, and these are ones which get stored as a fat in your adipose tissue. So eat whole grains, fruits, vegetables, other fiber-rich food can take longer to digest. It reduces the amount of calorie you put in your body. Refined grains, food high in added sugar, are digested very quickly and just gives a high dose of calories to your body, and that's what causes issues. So warning signs of diabetes. So what are the things that should make you go to a physician and get checked for diabetes is like if you feel frequently thirsty, frequently tired, frequently hungry, blurry vision happens like very late in the diabetes, going to bathroom frequently, losing weight quickly. So these are the things, if you notice, talk to your doctor, make sure you're getting screened for diabetes, and so forth. So again, just simple 7, hot, healthy diet, physically active, avoid smoking, keep a healthy weight, blood pressure, cholesterol, and blood sugar levels. Please monitor these things. So I saw some questions that you guys sent, and I just want to address some of the questions now, and we can address more questions at the end. So some asked about who needs statin therapy, right? So again, any decision to start statin should depend on your whole health in general, depends on your risk factors, depends on your age, depends on a lot of things. But we have something called society guidelines. This is what the Heart Association guidelines are. So in general, measure the LDL level. LDL level is what we are targeting when we start statin, not the total cholesterol level. It's the LDL what's causing the problems. So LDL more than 190 definitely needs statin therapy, no question about it. And LDL is less than 190, then we do something called 10-year cardiovascular risk. So we calculate what's your risk of getting a heart disease in the next 10 years. So there are some online calculators to do that, and I will show you the link in the next slide. So if your risk is less than 5%, meaning your LDL is less than 190, and your risk of getting heart disease is very low, then we don't typically recommend statin. We say, start working on lifestyle modification, start working on watching a diet, increasing activity, and all that stuff. That is for patients with a low risk of getting heart disease. If they're intermediate risk, say that they have 5 to 10% chance of getting a heart attack or any heart issues in the next 10 years, then we discussed with the patients about starting them on a statin. If the risk of getting heart disease is more than 10% in the next 10 years, then it's definitely, we proceed with starting the patients on statin. And once the statin is started, we repeat the LDL level in 6 weeks to see if the statin is working or to see if the statin dose is enough. And if the statin, if the LDL level is still high, then we try to switch to a higher potency statin or a higher dose statin, try to get the LDL level under control. And if somebody's risk is more than 20%, if LDL level is more than 100, then that's an indication to start statin as well. So this is the risk factor calculator that I told about. So this is the American Heart Association guideline, which recommends using this calculator to calculate what's the risk of getting a heart disease in the next 10 years. And we use that in this to determine who will benefit from statin therapy to reduce the bad cholesterol levels. But there are some limitations for this. I mean, this is the guideline. This is developed based on multiple data points, but the data came from a study where they studied patients between the age of 40 and 79. So we really don't have significant data on starting statin on anyone less than 40 years of age or anyone who is more than 80 years of age. So in those situations, we have to use some clinical judgment and see what the risk factors are and make some decisions based on the other things. And also one other thing is ethnicity. It doesn't, because it doesn't have a lot of Asian population or South Asian population that are included in the study when they came up with this calculator to calculate the risk. And in general, South Asian population, we have a little higher risk compared to the Western population in terms of developing heart disease issues. And also it doesn't include your family history. So it does ask for your age, gender, race, cholesterol level, blood pressure, and other things, but does not take into account family history. So if somebody has a really strong family history, so that addition is also needs to be individualized on top of this algorithm. When the algorithm is just a guideline, but this guideline doesn't apply to everyone. We have to take into account the other risk factors they may have and make a decision based on that. So individualized decision making is very important in deciding who will benefit from medical therapy for high cholesterol, who are okay to continue to try some non-medical therapy like controlling your risk factors and modifying diet and as such to control the cholesterol levels. And I saw some questions about diabetes and statin too. So the bottom line is the data is inconclusive. So there are about 6 studies which came out looking for correlation. And out of these studies, only one study showed an increase in risk of diabetes with the high dose rosuvastatin. Rosuvastatin is a higher potency statin. There are a lot of statins. We have low potency statins, we have intermediate potency statin, and we have high potency statin. High potency statin are very good in controlling the LDL levels, bring it down rapidly. But the one study showed like when you use a high dose of a high potency statin, there's an increased risk of diabetes, but there were 40% reduction in cardiac events in that group which were taking the high potency, high dose statin compared to the other group. So there's a slightly increased risk of diabetes, but also there's a significant reduction in cardiac events as well. But this is the one study. Some of the other studies showed no correlation between statin and diabetes. So based on the data we have so far, what we think is the risk of diabetes is low when we use a low intensity statin, like a pravastatin or lovastatin. These are low intensity statin. Atorvastatin and rosuvastatin are high potency statin. So the risk of diabetes kind of intermediate with the atorvastatin, and the risk is a little higher when we use a high dose of a high potency statin like a rosuvastatin. The precise mechanism of how it develops, we don't know yet. But there's one thing we notice is that the majority of patients which develop diabetes after starting statin have pre-diabetes, and also they had a high risk of diabetes at baseline. So it also depends on what their risk factors before starting the statin therapy as well. So Asian population, especially South Asian population, we are more prone for abdominal obesity and low muscle mass with increased insulin resistance. So that also we have to keep in account when we decide to start a high dose or high intensity statin. And one of the analysis, which was meta-analysis, which was done in 2016, showed high dose of high intensity statin would lead to about 50 to 100 new cases of diabetes if we treat 10,000 patients with a high dose, high intensity statin. So the risk is there, but it is really small. But the benefit may outweigh the risks in some patients who have a high risk of getting heart disease. So, and somebody asked about who needs screening and what are the types of heart screening that we do. So if you're asymptomatic, meaning that you have no symptoms and your risk of getting heart disease is low, meaning your risk of getting a heart disease in the next 10 years is less than 5%, in general, no screening is recommended. You continue focusing on risk factor modification and eating a healthy diet and maintaining a healthy physical activity. And if somebody has atypical symptoms, meaning that the symptoms are kind of, if you have some chest pain, we are not sure whether the chest pain is coming from the heart or not, and the risk, if they have an intermediate to high risk, then we think it's probably better to do an exercise stress test. And the other patients where stress test would be better if they have multiple risk factors for heart disease, or if men over the age of 45 or women over the age of 55, if they've been having a sedentary lifestyle for a long time, and if they want to start an exercise program, it may be prudent to do a stress test, make sure the heart's okay before starting an exercise program. And also we recommend stress tests in patients who are involved in occupation linked to patient safety, like pilots or somebody who are responsible for lives of other people. Then that's somebody we proactively check for heart use. If the patient has atypical symptoms, but the risk is very low, there's a test called CT, coronary calcium score, which we can do. And if this test has a high negative predictive value, meaning that if the test is negative, it means that your likelihood of getting heart disease is very low. If the test is positive, it kind of doesn't tell you it is definitely there. Then we proceed with stress test on an angiogram based on the findings. And if somebody has typical symptoms, meaning that they have chest pain with like activity and they have a high risk, then we directly proceed with angiogram because their chance of having a heart disease is higher. That's all I have. I'll be happy to answer any questions.
Sarav, மியூட்ல இருக்கீங்க.
விமல், நீங்க ஏதாவது இப்ப பேசுறீங்களா? எங்களுக்கு கேட்கல.
கேக்குங்களா இப்போ?
இப்ப கேக்குதுங்க.
ஓகே.
இல்ல ஒரு கொஸ்டின் ஏதாவது இருக்கான்னு கேட்டாரு ஹரி.
Okay. Thank you, Vimal, for the presentation.
Okay.
சரவணன் கேக்குதுங்களா?
கேக்குது ஹரி, go ahead.
Okay. So, thanks. ரொம்ப இன்ஃபர்மேட்டிவ் ப்ரெசன்டேஷன் உங்களோடது. நிறைய பேருக்கு உபயோகமா இருக்கும்னு நாங்க நம்புறோம். எங்களுக்கு கொஸ்டின்ஸ் அனுப்பிச்ச எல்லாத்துக்கும் ரொம்ப நன்றி. அதுல இருந்து first set of questions.
Okay.
How to detect early if there are any problems with heart?
So I'll show you this one. So it really depends on your risk and the type of symptoms you have, right? So if somebody has no symptoms whatsoever, and if they have no risk factors, or like they have very low risk of getting a heart disease, then there is no reason to like do study to see what's going on and whatnot. They should just focus on risk factor modification. Okay. So if they have any problems or if the risk is high, then we can do some things like stress test, CT scan or angiogram to see what's going on. So this is like a general recommendation. If you don't have any risk factors and if you don't have any symptoms, there's no reason to go look for something.
Okay. Thank you, Vimal. Another question. How do we differentiate between a regular gas-triggered pain on the left shoulder or a shoulder muscular pain and a serious heart pain? Essentially, what are the symptoms of heart attack and what should we do immediately?
Okay. So that's a very good question. So in like anybody, like first time chest pain ondale, like only the main concern is whether it's from the heart or not, right? So typically chest pain from the heart is usually a pressure like pain, like you feel like somebody is like sitting on your chest, or sometimes it can be like burning type pain. It can be in your mid chest or your left side of your chest, and the pain can go to your jaws or your left shoulder or your left arm. And the pain typically gets worse when you try to do some exertion, like actually like stressful environment, or try to like do some physical activity. The pain can get worse, and the pain usually lasts for like few minutes, like not just like comes and goes, like it lasts for a few minutes. This is the typical anginal pain that you get from heart. But we have to understand, not everybody gets typical pain. So some can have atypical pain, some can have pain which are different than what a typical presentation is. And especially people with diabetes or elderly, they can have atypical presentations. Sometimes we have seen rarely that people presenting with nausea and having some like atypical pain, like they just feel like they're very nauseous, they are having some like pain like in the upper abdomen pain. In my lab, there's some presentations for heart attack or heart related pain. So typical pain may not be always present, and if you have any concerns, please talk to a doctor. They can ask you more questions to see whether the pain is typical or atypical, and also analyze your risk factors and decide whether you need further testing to rule out heart disease.
Okay, thank you, Vimal. Another question. Is it important to go to a doctor at the right time? But what is the point where we really need to go to the doctor?
So two types of things. Like one like preventive visit. Another one is like you go to a doctor because you have a problem. Preventive visit once a year, it's better. Just get a preventive visit, check your cholesterol level, check your blood pressure, just go see a doctor, make sure your vaccinations and everything is correct. So that's the thing, you need to go do it every year, right? And if you have, so chest pain, there's two different types of chest pain, right? One is like a stable angina, meaning that you get chest pain with exertion, and when you take a rest, the pain goes away. So adu vandu epdina, like when you have like a 70% blockage or more, that can cause that type of symptoms. And if you have any of those symptoms, you should see a doctor, and may need for the testing to see what's going on, whether to differentiate if the pain is coming from the heart or not. So adu vandu like different type of pain. The third type of pain, like, is that when you have a heart attack, when you have a pain which doesn't go away, you get a strong sensation that something is wrong, then you have to go to the ER to rule out a heart attack. And that is very important. So that in that situation, like when you have like a sharp, like when you have like a severe pain in your chest, that it's not going away, and you have other symptoms like you're sweating, you just don't feel right, then I think you should just call 911, go to the ER, let them do an EKG, make sure you don't have a heart attack. So these are like different types of presentations. So the best thing is like see your doctor at least once a year, get your cholesterol level, get your blood pressure, just have a general routine checkup once a year, so that if something is off, we catch it early and treat it accordingly before it becomes a problem.
Okay. Thank you, Vimal. Another question. Lately, we hear a lot of young adults who's come to heart disease. What do you think can be done to prevent this, mainly in the younger adult population?
So that's a good question, and it's a very, very good question. And we are seeing this more commonly in younger people too. So I think we are going through a lot of stress in workplace. Number one, we are not watching your health. We are putting profession in front of our health. That is what I feel too. And try to, avoid stress if at all possible. Stress increases your risk of like having other problems too. So try to pay attention to your health. Try to eat at regular intervals. Try to eat healthy. Try to be physically active, and make sure when you're trying to achieve something, when you're trying to put your body through a stress, make sure your body is ready to take that stress. Like try to eat healthy, try to exercise properly, try to like do all these things. Like that's what I feel too. Like sometimes we're just like going through a lot of stress at workplace. We are just not eating healthy, we are not eating at regular times, we are not exercising, we have more sedentary lifestyle. This all becomes like a petri dish for heart disease to develop, meaning that we're just not taking care of our body. And we're I think that's one of the major factors. That's what I tell people to, try to eat healthy, try to eat at regular times, health first before anything else.
Okay. Thank you very much. Next question. Will cholesterol medication lead to diabetes?
Yeah, like I saw that question. That's why I gave this data.
Yeah.
There is a small risk if you take high dose of high intensity statin. The risk is very low when you take a low intensity statin. So there is a small risk, and that decision needs to be made like depending on your risk factors. So like sometimes when you have diabetes, your risk of getting heart disease is high too. So if you have a lot of risk factors, you have to analyze the benefit risk ratio. So the risk of starting a statin therapy is that there's a small risk of diabetes. The benefit of starting a statin therapy is that you're potentially avoiding a heart attack in the coming years. So you have to put that in perspective. See if your benefit you're going to get from the statin therapy is more than that small risk of getting diabetes. That's something you have to analyze for yourself and decide if you need the treatment or not. In any case, the first and foremost thing is to do what you can without medications, diet and exercise, to get your cholesterol under control. So this statin is only like recommended if you cannot control your cholesterol level despite doing having good dietary habits and having a good exercise program.
Okay. Thank you, doctor. The next question. If your total cholesterol is 200 to 220 for a long period of time, is it a good idea to start medication?
So you have to look into the LDL and HDL levels, right? So total cholesterol includes both. So sometimes if your good cholesterol level is really high, like which is rare in our South Asian population, but if your good cholesterol level is really high, that can also increase your total cholesterol. So see what your LDL level is and make your decisions based on the LDL level. So if the LDL level is high, then you decide what is your risk of getting heart disease in the next 10 years. So you determine if you have a low risk or a high risk. If your risk is high and if your LDL level is high, then it may be a good idea to start a statin to prevent a heart attack.
Okay. So thanks, Vimal. Next question. Even though LDL optimal level is less than 99, if the number is between 120 to 130 constantly, is it a warning sign to start medication?
Again, so on the level on this, like less than 100 is a good level, right? But generally, we don't necessarily have to start a statin unless your risk is high too, right? In the flowchart, like if it is more than 190, no question, you need a statin. If LDL is more than 120, we have to treat it, regardless of your risk factors, regardless of your other issues going on. If it is between 100 and 190, then it really depends on your risk factor. I mean, the thing is, if you have a strong family history, if you have diabetes, if you have like other risk factors like a high blood pressure and whatnot, then it may be prudent to start a medication to bring your LDL less than 100. But if your LDL level is 100 to 130, but you don't have any risk factors and you're having a really healthy lifestyle and you don't have any symptoms, you don't have much risk, you may not need a statin in that situation.
Okay, thank you. Next question. My A1C is 6. Will statins increase my blood sugar and cause type 2 diabetes?
It's a small risk. So if you see the people who got statin-induced diabetes, majority of people who had pre-diabetes. So A1C of 6 is pre-diabetes. So there is a small risk of progressing into diabetes with high dose, high intensity statin. We are not seeing that risk with a low dose statin or low intensity statin, but there's a small risk if you take if we have a higher dose of high intensity statin, there's a small risk of progression to diabetes. That is there, but you also have to think about your other risk factors, and you have to analyze your benefit of getting a statin. So if you take a statin, you're reducing the risk of having a heart disease. So you have to weigh in both. There's a small risk of having diabetes. There's a benefit of reducing risk of heart attack or heart disease in the future. So you analyze what's best for you and then make a decision based on that.
Okay. The next question is it okay to slow jog or walk every day for 4 to 5 miles? Will it be harmful if I do lots of physical activity?
So with regards to heart, anything which increases your heart rate, like aerobic exercise or cardio exercise, these are good. And if you can jog, if you can walk, if you can run, everything is good. Any activity is good for your heart, right? So but also you have to know your limits too. And sometimes if you over exercise yourself, it's not necessarily a heart issue, but you can sprain your muscles or you can have other issues because of over exercise. So don't slowly increase activity. Don't just go from sedentary lifestyle to a high intensity activity. Slowly ease into the activity. So if you're starting to walk and then jogging and then slowly increasing the activity, and then that's all good. I mean, any activity is good for the heart. Walking, jogging, running, anything is good. So that's not a problem at all. So the more active you are, the good for the heart. But my general advice is don't suddenly go from sedentary to running 3 miles at a high speed. So that's not going to be good for your other issue, like skeletal issues, but it's not a heart issue. It's not going to be a heart problem at all. So slowly ease into your activity, slowly increase your activity, and any activity is good. No problem if you jog, if you run 4 miles, 5 miles, it's all good for the heart. So from the heart perspective, any activity is good.
Okay, thank you, Vimal. How many times I can keep my heart rate at 70% during workouts?
So like I mentioned earlier, any activity is good. and if you're keeping your heart rate high, it's okay. It's all good. It's no bad effects of keeping your heart rate high. Listen to your body. See if your body's okay when you push yourself too much. If you start having symptoms, if you feel like your legs hurting, if you're very short of breath and whatnot, step back a little bit and try to go again. So there is no problem in keeping your heart rate high with activity.
All right. Saravanan, on set of questions.
Thank you, Hari. Thank you. Thank you, Vimal. Another question, Vimal. Difference between a chest pain, gas-triggered muscular pain, and what is it exactly we should be aware to go to the doctor right away?
So start with your primary care doctor. If you have any pain, right? So if you're not sure, sometimes it's hard to differentiate heart pain from a non-cardiac pain. Even for us, sometimes it's hard for us to differentiate. Typical pains, like how a typical pain looks like. The problem is not everybody gets typical pain. Some can have atypical pain. So if you have any unusual symptoms, talk to your primary care doctor. Sometimes primary care doctor can differentiate like pain coming from the heart and pain from like other issues like muscles. Like anything can cause chest pain. Like from your skins, muscles, bones, ligaments, cartilages, lungs, foot pipe, windpipe, stomach, heart. Like any of these can cause chest pain. But so talk to your primary care. So primary care doctor can differentiate most of the pain, and if they have any concerns, they will send you to a cardiologist. And when you see a cardiologist, then they can decide whether you need further testing or not. So my advice is, if you have any type of symptoms, better to check with your primary care than just putting it off.
Thank you, Vimal. Next one, the simvastatin. Is it a low or intermediate, or it's a high intensity statin?
So it's an intermediate statin, and really depends on the dose of the simvastatin too. So simvastatin, we are using at low dose. We moved away from using higher dose of simvastatin recently because we're noticing some interactions with blood pressure medications. So we typically use pravastatin, lovastatin, low dose simvastatin, atorvastatin, or rosuvastatin. These are the most commonly used medications. So simvastatin, like low dose, intermediate dose is fine. That's an intermediate potency statin. High dose simvastatin, like you have to make sure you're not taking any of the medications that can interact with it. So they should talk to the doctor if they're taking a higher dose of simvastatin and make sure it's not interacting with other medications.
Thank you, Dr. Vimal. I think your video is off, Vimal. Is it possible?
The screen sharing, So let me see. I can stop the screen sharing.
No problem.
Okay.
And the other question is, kids வரும்போது bit challenge. நம்ம இந்தியால இருக்கும்போது குழந்தைங்க we are used to play cricket and very active. இப்போ இங்க வந்து saturated fat become question. Pizza கொடுக்கலாமா வேண்டாமா, cheese fries கொடுக்கலாமா வேண்டாமா? How do you narrow down to say how much saturated fat is good in terms of kids or a health point of view?
So kids, they'll be fine. Like usually you should start watching a diet when you're in the 20s. So kids, when they're growing, they are okay with tolerating most of the diet. So kids gonna like mainly it's not whatever we're discussing. It's not applicable for kids. It's good to have a healthy eating habit since childhood. That's also good. Like when they grow up, they will probably maintain a good healthy habit. But from the heart disease perspective, children eating saturated fat or something, it's not that significant. It becomes a problem like later in the life, like when you're like 20 years old, 30 years old. That's when you should try to control your saturated fat intake.
Thank you, Mal. Next question, what kind of South Indian foods to be stopped for better heart health?
Stopped or started? Stop. So like I said, so high calorie stuff like white rice. Like the problem is, our South Indian diet is more carbohydrate focused, mainly because we were physically active like few generations ago. We were not this sedentary as we are right now, and like high carb diet was giving them the enough calories to meet with their physical demand. We are maintaining the same diet, but we are not maintaining the same level of physical activity anymore. So try to limit the total carbohydrate intake. Try to reduce white rice, and then sweets. Like, because sweets are just carbs, just putting in all the carbs, it just becomes a problem. So try to limit sweet. Try to eat more fiber. More unsaturated fats. These are better actually. So and again, the cornerstone is amount of calorie you put in and amount of calorie you use. Essentially, like if you're putting in this much calories, if you're using more than what you're putting in, then you're probably okay. But that's the problem with our South Indian diet, is that we have a lot of carbs, we have sweets, and as such. Like oil also, like olive oil is better, and also specifically extra virgin olive oil is better. So try to change to extra virgin olive oil if you can. That's like one of the better oils which we can use for cooking.
அந்த ஆக்சுவலா அடுத்த கொஸ்டின் அதான் இருந்தது. ஆக்சுவலா வீட்டுல வந்து செக்குல ஆட்டின நல்லெண்ணெய் சாப்பிடுறது நல்லதா? ஏன்னா பாதி காலமா சாப்பிட்டுருக்காங்களே நல்லெண்ணெய், தேங்காய் எண்ணெய், இதெல்லாம் வந்து நல்ல விஷயம். நிறைய விஷயங்கள் போயிட்டு இருக்கு இன்டர்நெட்லயும் மத்த ஹெல்த் டாபிக்லயும். உங்களோட தாட் என்ன?
So like looking at the composition of the oil, like like Mediterranean diet, the risk of heart disease, like people eating Mediterranean diet, is lower compared to other form of diets. And based on that, among all the oils, some oil is essential for like cooking food and whatnot, but limiting the total use of oil is good. And if you have to use oil, try to move to like a oil which has less trans fats and saturated fat, which would be olive oil. Is probably the better option.
Okay. Do we need to worry about a center chest pain which comes monthly once?
Again, they should talk to the doctor. It's hard to say without knowing the risk factors, without knowing other things, without knowing what the circumstances where the chest pain occurs, and what makes it worse, what makes it better, if the pain is going somewhere. So like we have to know all the things about the pain before determining whether it's pain or not, before determining whether it's coming from the heart or not. Also, even if you have like a pain which is atypical, if you have a lot of other risk factors for developing heart disease, it's better to get checked, better to maybe do some imaging to see what's going on. So if you have anything of concern, like if you have any type of chest pain, if anything worse, talk to your doctor so that they can investigate it further to understand the pain better. So, it's the pain, it's not just one component. I have pain here. Now that just only gives me one form, like one data point. Like I need more data points, like what makes it better, what makes it worse, where is the pain going, what circumstances the pain happens. So I need to know like more about the pain before determining whether it's an atypical pain or a typical pain, right? So even if it's atypical pain, if you have other risk factors, I will still do some imaging. And if you have atypical pain, and like based on in the data point, like if it's very clear that its pain is similar to the pain which is coming from a lung issue or a stomach issue, then I may not do further testing. But if there's a question, it's always better to check with the doctor, make sure they get more data points to help them understand the pain, so they can make a decision on whether if it needs to be investigated further, or we can just let it be.
Next one, are the blockages in the arteries are reversible?
So
natural way. That's what the question is.
So we have some data, like previously, like even our understanding of this are changing over time as we have more research, more data coming out. Previously, we thought, once you have a blockage, the only thing we can do is prevent it from getting worse. But recently, we have some data which came out in the last 5-6 years. If you bring your LDL level very low, meaning less than 50, and people have noticed regression of plaque. Meaning if you're the plaque now, it's like the blockage, cholesterol blockage which forms. And if your LDL level goes very, very low, people are actually seeing, the plaques actually regress over time. So that is possible to regress the blockage, but it all depends on your LDL level. Whatever way you can get it down, it's up to you, and it really depends on like what type of medications you take, what type of diet you follow, and all that stuff. But the cornerstone is your LDL level has to be very low before that type of process starts in your body to regress that plaque.
Thank you, doctor. Next question is, I'm watching my time also, don't worry, doctor, so I'll make sure.
That's okay, yeah, no problem, yeah.
How do you improve HDL levels can be a common, and is there any approach that we can follow to increase our HDL levels?
So HDL level goes up with diet and physical activity. Physical activity is very important to get your HDL level up. So if your HDL level is such like if it's low, then so the high HDL level is a negative risk factor for getting heart disease, meaning that if you have a high HDL level, it kind of counteracts some of the high LDL effect from high LDL. Most important thing is diet and exercise, as we said. And if we don't generally treat low HDL level per se, if you don't have high LDL level. So if LDL is good, HDL is low, we want routinely recommend diet and exercise. We don't necessarily treat with medication just for a lone HDL problem. And that being said, diet and exercise and physical activity helps with improving your HDL level. So try to increase your activity level. That will help with improving the HDL level.
Thank you, doctor. We'll have probably 5 more questions. That's all we'll have.
Sure, no problem. Yeah.
So, what is the best oil for cooking?
Like I mentioned, like extra virgin olive oil is probably the best based on the data we have so far.
Is almond milk is good for heart?
Again, you have to look into the nutritional facts, right? Try to look at the nutrition label, see what percentage of what's there. So that applies to any type of diet, any type of food. So basic thing is we have to understand the basic concept, and we can apply this basic concept to any of your diet. So you can look into almond milk, you can look into oat milk, you can look at all types of milks. Just look at the nutrition label. Make sure it doesn't have a high trans fat, high calories, high saturated fat. So higher amount of fiber, higher amount of unsaturated fat. So you just look into the label, and then you understand the basic concept of what a healthy food is. Then you can apply this concept to any type of diet that you want to take or you don't want to take. So you can look in the nutrition label, you can understand it further.
Statin therapy and a statin plan or statin, is it a temporary, or once you start taking statin, is it lifetime?
And also, so like it really depends on the risk factors. And so if somebody has a heart disease, right? Somebody already had a blockage, somebody had a stent, apdina, we say statin for life. So once you have heart attack, once you have a stent in the heart, once you have a significant blockage, then being on statin for the rest of the life reduces the future risk of having another heart attack. So we use it for that purposes. So statin only, there is 2 main purposes. One is to reduce your LDL. Number 1 is that, the drawing number that I showed you, some heart attack happens when the plaque ruptures and causes a blood clot on top of the clot. The statin has a property, it stabilizes the plaque, reduces the likelihood of the plaque rupturing and causing a blood clot forming on top of the clot. So it helps in that aspect too. So if somebody has a heart disease, if they establish heart disease now, we put them on statin for the rest of their life. If you're using it for prevention, that's another story. Then you decide how well your cholesterol level is controlled, how well your risk factors are controlled. Then we decide maybe you can reduce the intensity of statin, maybe reduce the dose of statin, or even come off statin if necessary. So primary prevention, there's a possibility you can come off of statin if you can modify your diet, if you can lose weight, if you can control your risk factors and whatnot. But for secondary prevention, meaning you already have a problem, we are preventing the problem from happening again. In that case, most likely you have statin for the rest of your life.
Thank you, doctor. Kids often like pizzas. How often or control can we give it and strike a balance?
So like I said, kids, they're fine. They're growing. They can take it. But the diet control mainly applies like as you grow older. So kids, the main thing in kids, when if you start healthy diet at a younger age, they're most likely to follow that when they grow up. So that's the main concept of controlling, like what healthy food they eat, what unhealthy food they eat. But kids will tolerate. They will take care of it. They won't have much issues because if they have unhealthy food once in a while, they won't be that, and they don't have that much effect from these like unhealthy food as adults.
I think the last question, I believe. I have 25% of blockage identified, and I'm a healthy lifestyle guy. I do workouts and try to be on diet. I'm on moderate statin therapy. is it going to be a long time? Will it be heading into diabetes?
So like I said, the risk of diabetes is very low. There is a small risk, but the risk is very low. And that being said, check your A1C once a year, make sure your A1C is controlled. Check your cholesterol profile once a year, make sure the cholesterol profile is controlled. 20% is, it's a very small blockage. Most people walking around may have 20%, 30% blockage without knowing it. That's there. So it's not going to cause problems. The 20% blockage by itself is not going to cause problem. Like you mentioned, keep following whatever you're doing. Make sure your cholesterol level and A1C level, everything is checked on a regular basis.
But do they have to be on the therapy, the statin therapy?
It depends on the risk factors, LDL level, risk factors and whatnot. So if they have 20% blockage and if your LDL level is very high and you have other risk factors, then probably statin therapy. And if you have 20% blockage, you have cholesterol level is well controlled, you may not need a statin therapy. It really depends on your risk factors.
Thank you, Doctor. I think last I'll go over and we'll wrap it up. This person didn't join early, so the question was, you already answered, but I just wanted you to repeat again.
Sure.
Is a cardiac arrest is same as heart attack?
So it's different. Cardiac arrest means that the heart stops pumping, right? Heart in the pump and cardiac arrest means it just stops pumping. That's cardiac arrest. It can happen when your heart goes into some abnormal heart rhythm, right? Heart attack, like the heart muscle, it keeps pumping, right? It needs constant supply of oxygen because it keeps pumping. It never stops. So if there's a blockage in the arteries of the heart on the outside the heart, the outside on there's arteries which supply blood to the heart muscle. If there's a blockage, and if there's a 100% blockage, means that the blood supply is cut off for a muscle, that is heart attack. Now, when that happens, the heart attack can lead to cardiac arrest. That's possible. Cardiac arrest means that cardiac arrest means like you're just unresponsive. Your heart is not functioning. You need to do CPR, trying to do other life-sustaining measures. Heart attack means you get chest pain. You're just like a part of the heart muscle is not getting blood. That's heart attack. So cardiac arrest and heart attack are completely different, but one can lead to the other.
Yeah, latest doctor actually வாயில வந்து நாங்க messages go fund கேட்கும் போதெல்லாம் நிறைய youngsters 30s and 40s late 30s and early 40s கார்ல உட்கார்ந்துட்டு இருக்காங்க அப்படியே they just fall down and collapse. And we heard things like that, like pretty instantaneous and quick. அப்போ வந்து அது முடிஞ்ச எல்லாரும் கேட்டாலும் டாக்டர் சொல்றது வந்து that's a cardiac arrest அப்படி சொல்லிடுறாங்க அது.
Right.
அப்போ cardiac arrest போது அது சிம்டமே இருந்திருக்காது அந்த பேஷண்ட்டுக்கு before when things like this happen.
So cardiac arrest like most common cause of cardiac arrest is heart attack. So cardiac arrest can be from other things, like if you have like any electrical problems, like if you're born with some type of heart issues, those can also lead to cardiac arrest. There is a rare situation where we don't know what caused cardiac arrest. Sometimes it happened and we just can't find a reason why it happened. But most common cause for cardiac arrest is a heart attack. So when heart attack happens, there's a part of a heart muscle doesn't get blood supply, abrupt cessation of blood supply, and then the heart muscle can lead to some abnormal heart rhythm, and that can cause cardiac arrest. So most likely cause is like they may have had a heart attack leading to cardiac arrest. Less likely that they may have a cardiac arrest without a heart attack. That's possible. And sometimes we just can't find a reason. That happens too. It's very, very rare, but it happens too. Sometimes autopsy will give us the answer. Like if they have autopsy will tell us what led to the cardiac arrest. Like if they have a heart attack, we can find that in autopsy. They can say the blockage in the artery and whatnot. So, and again, most important thing we can do is to maintain healthy lifestyle changes, and then try to check your cholesterol level, diabetes level, and whatnot. Have a healthy diet, maintain physical activity. That's like the cornerstone of anything, like trying to keep your body healthy. You can that's what we can do to avoid risk of having any of these things.
Thank you, Doctor.
Yeah.
Would you be able to have 5 more minutes with us?
Sure. Yeah.
If your heart rate goes to 170 plus during workout, will it cause abnormal rhythms?
So short answer is no. Like what is the maximum heart rate? So like your max heart rate depends on your age. So if you're a 30-year-old, your max heart rate is about 190, 220 minus age. That's how we measure the max heart rate. If you're a 70-year-old, again, so your heart rate, max heart rate is usually 220 minus 70. So that's like the max heart rate. That's the amount of that's like the likelihood of how high your heart rate will get to if you exercise. So if you're 30 years old, if your heart goes up to 190, that's all expected, because that is how the heart is programmed. You know, when you exercise, like the body needs a lot of blood. You know, skeletal muscle. You know, we are exercising, we are just using a skeletal muscle a lot. The skeletal muscle needs a lot of blood, and the only way to increase the amount of cardiac output going to the skeletal muscle is to increase the heart rate. So the heart pumps faster, you get more circulation, more blood going to the skeletal muscle. So it's all expected to have heart rate going up to 220 minus your age. That is kind of like your expected max heart rate.
Okay. Many young adults, we see they go for angiogram tests nowadays, even for light symptoms. When do we really need angiogram?
Angiogram, typical symptoms, high risk. Two things. If like when they explain the chest pain, we determine if it is typical or atypical. So if the pain is typical, meaning it's very concerning for a cardiac event, plus they have other risk factors, strong family history, uncontrolled diabetes, so like uncontrolled LDL, like they have a lot of risk factors and they have typical chest pain. That is when we recommend angiogram, because angiogram is invasive, number one, and all invasive procedure, there's a small risk of complication. So it's not without complication. So only when you have a typical symptom and you have risk factors, like high risk factors and multiple risk factors, then we proceed with angiogram. That happens very rarely. Most of the time we do some sort of non-invasive testing before going with angiogram. The non-invasive testing will help us identify if the pain is coming from the heart or not, like a stress test or a CT coronaries, something like that. So we don't typically jump into angiogram unless just based on what the patients tell us. It's just like very typical of pain coming from the heart. Like I've done it a few times, but the thing is, like, by just hearing the story, hearing the symptoms, it gives us a high suspicion that the pain is coming from the heart. If that is the case, then angiogram is a definitive way of knowing for sure what's going on. And if you have atypical symptoms, not much risk factors, it's better to do some non-invasive testing first before rushing into angiogram.
Okay, Doctor. Last, that's it.
Okay.
From childhood and my adulthood, my heart rate is always usually, even the adulthood, my heart rate is 80. And then the rest, it goes down to probably in the sleep or 60. But is 80 is bad? No.
So normal heart rate is 60 to 110. As long as your heart rate is 60 to 110, that's all normal range. If you're active, your resting heart rate is going to go low. Resting heart rate can go down to 50s or even high 40s. No problems. If you're athletic, if you're active, your resting heart rate is going to be low. So any heart rate between 60 and 110 at rest is normal.
Thank you so much, Dr. Hari. Question irukka?
I think இது வரைக்கும் அந்த எல்லா கொஸ்டின்ஸும் கவர் பண்ணிட்டோம்னு நினைக்கிறேன் சரவணன். வேரியஸ் ஸ்பெக்ட்ரம்ல வந்த கொஸ்டின்ஸ் எல்லாமே ஆல் கவர்ட். தேங்க்யூ டாக்டர் விமல், உங்களுடைய வேல்யூபிள் டைமை ஸ்பெண்ட் பண்ணி அரிசோனா தமிழ் சங்கம் குரூப்க்கு இங்க நிறைய பேர் கேட்ட கொஸ்டின்ஸ் எல்லாத்துக்கும் பொறுமையா ஆன்சர் பண்ணி நிறைய இன்சைட்ஸ் கொடுத்ததுக்கு ரொம்ப ரொம்ப நன்றி. We know your time is very valuable. Luckily உங்களுக்கு இன்னைக்கு கால் கிடையாது, Sunday. That also helped us.
Yeah, thanks for giving the opportunity. It's very nice to talk to people, try to educate on the questions. And it's people have questions all the time. They rarely get the opportunity to get the information. Online they get all types of information online. So it's kind of important for people to know what's important, what's not important. So thanks for the opportunity. And எல்லாத்துக்கும் கார்த்திகை தீபம் வாழ்த்துக்கள் இன்னைக்கு.
Thank you so much, Doctor. தமிழ் சங்கத்தின் சார்பாக நானும் ஹரியும் நன்றியை தெரிவிச்சுக்கிறோம். Go ahead, Hari.
ரொம்ப நன்றி டாக்டர் விமல். அனைவருக்கும் கார்த்திகை தீப நல்வாழ்த்துக்கள். ஒரு சின்ன அனௌன்ஸ்மெண்ட். அதுக்கு முன்னாடி அரிசோனா தமிழ் சங்கம் இதே போல இன்னும் நிறைய மெடிக்கல் ரிலேட்டட் ப்ரோக்ராம்ஸ் ரொம்ப பயனுள்ளதா more and more we will continue to offer. உங்களுடைய பார்ட்டிசிபேஷன் தான் எங்களுக்கு மோர் என்கரேஜ்மெண்ட் கொடுக்கும். ஸோ கீப் பார்ட்டிசிபேட்டிங். நல்ல கொஷின்ஸ்லாம் கொண்டு வாங்க. we will try to bring in more valuable Dr. Vimal Mari Nalla specialist. We will try to have some sessions. மிக்க நன்றி. அதுக்கு முன்னாடி ஒரே ஒரு சின்ன அனௌன்ஸ்மெண்ட். சரவடியோட ட்ரெமெண்டஸ் சக்சஸ்க்கு முக்கியமான காரணம் உங்களோட பார்ட்டிசிபேஷன் தான். முதல்ல அரிசோனா தமிழ் சங்கம் சார்பாக எங்களுடைய நன்றியை தெரிவிச்சுக்கிறோம். ஸ்டார்ட் டு எண்ட் ப்ரோக்ராம் ரொம்ப சக்சஸ்ஃபுல்லா போனதுக்கு கண்டிப்பா உங்களோட ஒத்துழைப்பும், நீங்க கொடுத்த வீடியோஸ், நீங்க கொடுத்த ஃபிளாலஸ் வீடியோஸ், நல்ல கண்டென்ட் உள்ள ப்ரோக்ராம் தான். அந்த சக்சஸை தொடர்ந்து அடுத்த ஒரு ப்ரோக்ராம் இந்த மந்த் ஆஃப் டிசம்பர்ல நாங்க பண்ணலான் இருக்கோம். ரொம்ப வருஷத்துக்கு முன்னாடி இதை பண்ணியிருக்கோம். நடுவில் ஒரு சின்ன பிரேக். இப்ப மறுபடியும் அதை வந்து ஆரம்பிக்கணும்னு ஆசைப்படுறோம். இந்த கொரோனா டைம்ல ஏதாவது ஒரு நல்ல ஒரு என்டர்டைன்மெண்டோடையும் உங்களோட சந்திக்கணும்ட்டு அடுத்த ப்ரோக்ராம் ஆன் December 26th மெல்லிசை மாலைன்னு. Just let me share my screen. Saravan screen share. கொஞ்சம் பாஸ் பண்ணுங்க ப்ளீஸ். December 26th evening 6 PM ஸ்டார்ட் பண்ணலான்னு இருக்கோம் ப்ரோக்ராம். ஒரு 2 hours. ஃபார்மேட் வந்து வீடியோஸ் ஷேர் பண்ணுங்க, தமிழ் ஃபிலிம் சாங்ஸ், ப்ரீ ரெக்கார்டட் சாங்ஸ் வேலியில் இருக்க நீங்க ஷேர் பண்ணுங்க. 5 minutes லிமிட். ஒரு பார்ட்டிசிபெண்ட்டுக்கு ஒரு லிமிட். ரெஜிஸ்ட்ரேஷன் ஃபார்ம்ஸ் நாளைக்கு ஓப்பன் பண்ணுவோம் நாங்க. ஸோ ரெஜிஸ்டர் பண்ணிட்டு உங்க சாங்ஸை எங்களுக்கு அனுப்புங்க. அதுல எல்லா டீடைல்டு இன்ஃபர்மேஷனும் இருக்கு. அந்த கைட்லைன்ஸ், எப்பக்குள்ள வீடியோ சப்மிட் பண்ணணும், என்ன ஃபார்மேட்ல வீடியோ சப்மிட் பண்ணணும், நம்பர் ஆஃப் என்ட்ரிஸ், எல்லா விஷயமும் இருக்கு. அதை பார்த்துட்டு ரீச் அவுட் டு அஸ். என்ன கொஸ்டின்ஸ் இருந்தாலும் ரீச் அவுட் பண்ணுங்க. நாங்க we will provide all the valuable information required. அடுத்தபடியா அந்த ப்ரோக்ராமுக்கு நாங்க ரொம்ப ஆர்வத்தோட எதிர்பார்த்துட்டு இருக்கோம். AZTS@aztamilsangam.org இமெயில் அட்ரஸ்க்கு உங்க கொஸ்டின்ஸை டைரக்ட் பண்ணுங்க. ஜாயின் பண்ணதுக்கு ரொம்ப நன்றி. Let me see if I have the presentation. Saravanan and
ஹரி
அந்த பிரசன்டேஷன் கிராண்ட் பண்ணுங்க. அந்த
இதோ
விமல் நீங்க ஹோஸ்டா இருக்கீங்களா?
I make a host right now.
Let me change that.
Okay,
no, Hari is
thank you.
host now.
Yeah, thank you. So December 26th 6 PM எல்லா கைட்லைன்ஸும் அந்த ரெஜிஸ்ட்ரேஷன் லிங்க்ல இருக்கும். Thank you very much for all the support. Thank you very much.
Thank you, Dr. Vimal. Thank you so much.
Thank you. Somebody asked me like if they wanted some my information, so என்னோட email வந்து போட்டிருக்கேன், so they can just email me if they have any issues. So Veerappan@arizonaartspecialist.com, so they can email me if they have any issues too.
Thank you, Vimal. Thank you so much, Dr. Vimal.
Well, take care.
Thank you, everybody.
Thanks.
Bye-bye.
Thank you.
Bye.
Thank you. Bye.